Everyone, it's Dr. E, the NP with a PhD, and I just had the absolute honor of being a guest on the Dr. Ellie Stein podcast. I first discovered Dr. Stein when she came on my show, The Medical Disruptor, and I instantly fell in love with everything she brings to the world, her insight, her compassion, her ability to name what so many of us feel but don't have words for. It blew me away. So when she invited me into her world, I was all in. And we had a powerful conversation about medical gaslighting. That is my area of expertise. We talked about what it is, what it isn't, and exactly what you need to do to stop it from ever happening to you again. It's raw, it's real, it's my favorite topic, and it provides the type of clarity that could really change your entire healthcare experience. Anyway, I hope you enjoy it.
Hi, everybody. I'm Dr. Ellie Stein, and welcome to the Dr. Eleanor Stein Podcast. You are going to love this episode. It's on a topic so many of us have experienced: medical gaslighting. My guest is Dr. Efrat LaMandre, or Dr. E, as she goes by. She's a nurse practitioner who also has a PhD. Efrat started off in a conventional medical nurse practitioner practice called EG Health. But everything changed when her wife became ill. Like so many of us who are medical disruptors, she soon realized she needed to learn more. This led Efrat, or Dr. E, on an intense journey to find deeper answers. She explored integrative and functional medicine, bringing these insights back to her patients. And she has become a fierce advocate for her patients and clients through her book, It's Not All in Your Head, her Medical Disruptor podcast, and frequent sharing of validation and information through her social media and speaking engagements like this one. She is validating the experiences of millions, literally millions, because her social media reach is vast. Her journey has been one of transformation, pushing boundaries, and redefining what's possible in medicine. I am honored to have Dr. E on the podcast today to share what she has learned about what needs disrupting in medicine and about medical gaslighting in particular. Efrat, welcome to the podcast.
That was like the best intro ever. Can you go before, like, introduce me everywhere I go? Thank you.
Absolutely. Happy to do it.
That was great. Thank you for having me.
So could you start by just kind of sharing a little, you've got an unusual background. So just sharing kind of your training, how you got into this field, and then how you made the shift from conventional to, let's call it, unconventional medicine.
Yeah, I love that. And you know, it's so sad that it's unconventional medicine because it's really conventional medicine done right. I know you know, and I know your audience knows. Okay, so I started off as a nurse practitioner. For those who maybe don't know, are nurse first, and then you can go to nurse practitioner. In most states, majority of states in this country, you have more or less the same autonomy and prescriptive authority as an MD. NPs are primarily in primary care, some specialties. We don't do surgery. And so with that, I opened a primary care practice, pediatric, adult, house calls, and it's become one of the largest NP-owned practices in the country. So just think of just your regular primary care. That's what we do at EG Healthcare. So all of that is to say that I'm, neck deep in primary care and conventional medicine, in the algorithms, in the protocols. And I think it's important to come from that. I think there is a difference from someone maybe who's on the outside of medicine, not that they don't have the right to critique it, but it's a different lens than someone from within medicine. It's actually the criteria to be on my podcast, which is someone has to be kind of well-versed in some sort of conventional medicine and then come over to the dark side. So that's what I did. And I was trucking along doing all the things that I thought were great. I call myself a recovering medical gaslighter. I don't know if I'm going ahead or if I should just keep talking.
Yeah. No, I'm riveted so far. Yeah.
Okay. Feel free to interrupt also. I love interrupting.
Okay.
Okay. So, anyone who comes into my practice, I'm very, very eager to take care of my patients. Mr. and Mr. Smith, come on in. Oh my goodness, you're not feeling well. Amazing. And I would use every single toolbox that I have from evidence-based medicine. And when I would discover that nothing is wrong, I would say, you're fine. And I had no idea or intention that this was disempowering, because you're fine. Like, all my stuff says you're fine. And over time, I've come to appreciate that that is not enough. I didn't know that that was medical gaslighting. I've come to appreciate that enough. And I came to appreciate that through my wife's journey. She was very ill. She had 2 autoimmune issues. PMLE, polymorphous light eruption, which basically means allergy to the sun. Yeah. So she was, in a previous lifetime, she was a career as a Division I coach. She got into medicine later, but which meant she couldn't be outside in the sun. She had to change careers. And then later developed some pretty serious psoriasis, like on the soles of her feet. She couldn't walk, on the palms of her hands. So it was really debilitating. At that point, she's in medicine, I'm in medicine, our friends are in medicine, and we read the protocols and the guidelines and the journals, and it was pretty much nothing you can do. Stronger meds, stronger meds, stronger meds, stay outside of the sun. Just a lot of life adjustments. This was pre-internet the way it is now. And so I was just among colleagues. I was sharing a space with some chiropractors who, when it comes to spatial functional medicine, they are the pioneers in that.
Yeah.
And they said to me, there is a way out of this. And I was like, no, there isn't. I know there isn't. I'm steeped in the facts and the evidence. And they said, no, you have to talk to this one doctor. And I was like, okay, like, heavy eye roll. So this is not going to work. It's just nonsense. But what do you have to lose? Nothing to lose, right? So we went, and he introduced us to this whole world of lab testing and the concept that your food can actually affect your skin. Outrageous concept. Not discussed ever, ever. And so we're like, yeah, sure, whatever, guy. And like, we'll do this diet. Like, that's fine. And mind you, we are healthy eaters. We are relatively thin, athletic women. We're not eating McDonald's. So the idea that we're not eating healthy was so insane. But okay, we'll just follow this protocol. He put us, at the time, something called AIP, which we didn't know what that was at the time.
Well, this is fascinating.
And it's crazy, right? And then within days, her psoriasis started going. Like, we couldn't believe it. We started taking pictures because we were like, this has to be a fluke. And we just kept taking pictures and just watched it. It was kind of a gift to have something so, so visual. It's not like joint pain or headache. Like, do I feel it? Do I not feel it? Like, we watched it disappear. And then within weeks, she would suddenly say, because we would know how much time we could be outside before she'd get kind of like a tingling. Our time kept stretching until eventually she was just able to be in the sun. And this is a woman that we really could not leave until the late afternoons. And now we started going out in the sun. So within weeks, not months, not years, within weeks, our entire life changed. And I was like, okay, this is insane. And I didn't tie it yet to the, medical gaslighting, because I was like, okay, disease. So I started taking a class and another class, eventually got certified by Institute of Functional Medicine, eventually got the PhD in Integrative Medicine. But once you start learning these tools, and I'll pause here, once you start learning the tools, you come back to your conventional and you start realizing this is not enough.
Yeah.
Yeah.
Wow. And tell me, I love the name of your podcast. It's Medical Disruptor. So what made you decide, okay, it's not enough just for me to learn this stuff and to help my patients, but I actually want to change the whole medical system?
I actually want to change the whole world.
Okay. I underestimated.
But I don't want to change the medical system. I want to recontextualize it. And that's a really good point, because the medical system is great at doing what it does. Mm-hmm. So my professional progression was once I started realizing this, at some point I developed a functional medicine practice, as many of us are wont to do. And I started seeing patients one-on-one and really had the honor of impacting people's lives in a way that it was so gratifying. It was so gratifying to see people who were just really just ushered out of the system, really disheartened, and getting them better together. It's not like it's not like from above. Getting it together, we got together. They got them better. But then after a while, personally, that became not enough, this one-on-one care, because a lot of it was also redundant. Like if, I heard myself saying the same things over and over again. And then I realized the messaging could get louder. And the podcast came, the TikTok came, and now I'm working on my second book. And the idea here, so my mission has become, and it sounds as one thing, but then I'll explain it as other. My mission has become specifically for women to never experience medical gaslighting again. Now, at first, this feels like, just as you said, to change the medical system. But that's not what it is. The medical system is doing exactly what it's designed to do, right? Which is to define disease and treat it, find pathology and treat it, and find a protocol and treat it. And when we have a disease or a pathology, oftentimes it has the best tools. Not always, but oftentimes it has the best tools. But many of our patients who are in the state of I don't feel good-itis are not going to be identified, classified, or diagnosed by that system.
Right.
So if I can empower our mutual listeners to understand that conventional medicine is wonderful, it's great, but it's just one tool. It's a division that's sometimes a department that sometimes we need to go to. And certainly if I have a broken foot, I want that. And if I have to get my appendix removed, I want that. And if I have pneumonia, I want that. So there's a place for it. It's certainly not, but once we contextualize it as just one tool and understand that there are so many other tools that are validated and valid, including your own symptoms and your own body that is valid and we have to listen to, then you will never experience medical gaslighting again. Does that make sense?
Yeah. So what is your definition of medical gaslighting?
I love that.
I ask this when the term first started getting used. I'm like, I really had no clue what it meant. I started asking different people. Of course, you get different answers.
Yeah. And I love that because I use it purposefully because it lands for people in this way of like, I kind of think I know what it is. And I use it because I want to get very quickly in one term for the audience to understand, to have this visceral feeling of like, I think that happened to me. All right, so medical gaslighting comes from the term gaslighting, which is a psychological term, which has to do with the intentional manipulation of reality such that the person starts to question their own reality. That's the kind of like the technical term for gaslighting. Medical gaslighting is the feeling that your doctor is doing this medically. It's the insinuation that not only are you fine, but if you're not feeling anything, if you're not feeling fine, it has to be in your head.
Right.
So that is what it is. And I think most people, when they experience medical gaslighting, think there's an element of malice to it. The doctor doesn't care. Now listen, there's always a subset of people who are just not kind. So I'm not referring to them. But there is this, the doctor doesn't care, or they're greedy, or they have an underlying. So medical gaslighting also, in saying that, brings a lot of emotion to it.
Right. Like I've been victimized. I've been hurt and you did it.
And you did it, yes.
The medical professional, not you personally. Yeah.
Yes, exactly. And so I use that term for the audience to be like, yes, that's me. Let me hear. But I actually don't think that that's actually what's happening, but I have to get you here somehow. And it's a universal term, and there's this feeling, and it's a universal experience, especially for women, and especially for Black and brown women or LGBT women. So the experience is real, but that medical gaslighting term is a little bit incorrect. So it brings you in. So that's why I'm glad you asked that question. But in reality, what has to happen, and this requires a conversation, which I hope will unearth, is, and again, I'm speaking for women at this point because I think it just happens more often, but the women actually have to question their own medical assumptions. And I'll explain what that means. And if you start questioning your own medical assumptions and get the answers, you won't experience medical gaslighting. Again, I'm not talking about that 2% of absolute horrible people. So what do I mean by questioning our medical assumptions? First, we have to talk a little bit about what we can and can't expect from our doctors. And then two, we have to talk a little bit about how we have come to accept that all the answers lie in our conventional medicine office. And when we don't get it, we go to another one, another one, another one. We've come to accept that they're the only source of truth. We've silenced our connection to our own bodies. We've silenced because our conventional doctors often don't approve of some of this other testing, we take their word of validation over ours or other labs. And so we close ourselves off to a lot of options and we keep going back for more.
Right.
So we have to look at ourselves a little bit and learn how to validate things on our own. Does that make sense?
Can I just maybe ask a question here at the risk, being a medical disruptor, I'm always at risk of pissing some people off. So
Let's do it.
In my work over many, many years, I ran groups for people with complex chronic diseases. So myalgic encephalomyelitis, fibromyalgia, more recently long COVID, chronic pain, all the comorbidities. And I came to realize that so someone can do an action to me, in this case, like medical gaslighting. So they can say, oh, maybe you're depressed, maybe you're stressed, maybe you're hypochondriacal, there's nothing wrong with you, your tests are all normal. I mean, this is like every day, right? Happening every day.
Sure.
Then how I receive that information is more to do with me. So I can only feel victimized if I kind of let it land in a certain way. I think we're kind of saying the same thing, maybe in different language. If I have confidence in my own experience as a person with a body, a mind, and a spirit, etc., then I can more easily say to that person, you know what, that's not correct. That's not aligned with what I'm experiencing. Is that kind of what you're saying? Like, for me, I would have to gently bring up to people, this is the inner work. So people would complain about doctors, but other people in their lives too, their partners, their family, their friends, who would say, you know, maybe you just need to get out more. Maybe you need to do a bit more exercise. Maybe you got to quit thinking about yourself and worrying so much, like really putting the blame for the experience on the patient. And they would be just incensed, like, I need to put all my effort into making this person understand. And what I came to realize, you know, over years and years of doing this is you have to believe in yourself. And once you believe in yourself, this negative input coming from the outside, the invalidation, it's still problematic because it impacts how that person is treating you and maybe your access to tests and services. So I'm not saying it's not a problem, it absolutely is, but how you feel about it and the like emotional toll it takes, we have some agency over that.
Without question, we're saying things that are very, very similar.
Okay.
And I know that you're going to resonate with what I'm saying now. Like, I know we're both saying that we're not victim blaming. I know we both agree there. And I know that that's the concern that you have when we're surfacing this. So we're not that, but I agree with you wholeheartedly that what we're talking about for these patients is not, hey, doctor, you medical gaslight me. Let me advocate and be militant and change you. Next time I walk into this office, I want a different experience. No, it's a shift perspective. It's, hey, doc, I recognize all this, got it. But I'm going to use the skills that I actually use every day in my life, and I'll show you what I mean in a moment. And if I could just bring those skills here into medicine, because we we give up our power when we go into medical practice. We are so indoctrinated from day zero that doctors know best and we don't know. And they do know, I'm not taking away from that, but we've given away some of this power. And I don't mean power again, coming in and like banging on the table. I'll give a classic example, right? You have a leaky toilet. You could see it's leaking, it's there, right? You call your carpenter who's hung up shelves for you so many times over the years. You love this guy. He agrees to come on a Sunday. He comes, he takes a look at this toilet bowl. He uses all the tools in his toolbox, his hammer, his nails. He walks away from the toilet, comes back to you, and he says, I've tried everything, and I've come to the conclusion that your toilet bowl is not leaking. Now, you wouldn't even get mad at this guy. You'd probably be mad at yourself and say, I called the wrong guy. I should have called the plumber. This guy's a little bit off. But you would appreciate that he came on a Sunday, used all his tools, used his max effort of reasoning, and you just called the wrong guy. Now, you're not going to swear this guy off. You're going to call him next time he needs shelves or floorboards, but you're never going to call him again for this. And we would never relinquish our power in this situation. We wouldn't be like, oh, okay, maybe our toilet's not leaking. And also we wouldn't get mad and say, this guy's gaslighting me. You'd be like, this guy's limited.
Right.
Okay, that's what power looks like when you understand it. So when we go into the medical office and they're like, listen, I did everything in my toolbox and you're fine. And we're like, oh, okay, I guess I'm fine. Maybe I am anxious. Maybe it is in my head or, wow, this guy really gaslit me. No, you could just be like, okay, thanks for trying everything in your toolbox.
Right.
I know what I feel. I know I have brain fog. I know I'm in pain and I know I'm not anxious and I know I'm not depressed. I have a great relationship, blah, 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 blah. This is not that. And I know this. And I'm not going to get confused by your limited tools. I'm going to say thank you. I'm actually so grateful that you found nothing because you only find diseases.
Right.
And I will turn and find someone like you or someone like me and say, okay, this is what I'm feeling. I've already cleared it with these guys. In fact, I'm sure you feel the same way that I want to make sure that you saw them.
Absolutely.
When I used to see patients, I wanted did you get all the blood work done, the scans done, like everything negative? Amazing, perfect. We did that. And then you turn here, and that's what power looks like. And that is what the shift looks like to undo medical gaslighting. We don't ask them to change.
Right.
We change ourselves. So it's interesting that you say the word validated because it's the current title I'm playing with. You said it a few times. And it's really about validating in a few ways. We want to feel validated, obviously, but we do that by validating ourselves. My symptoms are valid. Even if you can find, they're valid. My toilet bowl is leaking. And I don't need to convince you of that. And then I need to understand that if I'm looking at tools or interventions that my doctor doesn't validate, I have to find a way to validate myself. So if my doctor says to me, a keto diet, AIP diet will not help your wife's psoriasis, but I do it and psoriasis is gone, that's valid. It's valid. I get it. It's an N of 1. I get it. I didn't do a double blind study. I get it, but it's gone. Right? So I can do my own interventions and my own studies and move my own variables also. So I can validate things myself. If I do a urine test that, again, conventional medicine insurance doesn't pay for, and I can objectively see something, and then I could do an intervention of a protocol, and then I can objectively see a change. Again, I get it. It's an N of 1, not double blind with millions of dollars behind it, but I can validate this. And I could also see, if I can qualify and quantify my symptoms. So there are other means of validating, and we do this all day long, right? Everybody comes up with their system of how to choose their hotel. I'm going to use ILEC 4.8 only, not 5. Like, we are all day long validating things with systems that we are creating that work for us, but we relinquish all of that to the white coat. Does that make sense?
And I know, or I think, or I'm going to ask maybe, that we go deeper than that, because the person in the white coat has also relinquished all their power
to the protocol.
To the protocol. So, for example, I'm just reading a book right now on cholesterol. I've been searching for someone to do all that work for me and put it all together. Finally found the book. I'm like, it's like a novel. I can I'm just like inhaling it.
Oh, share it.
Finally. Yeah, so it's Dr. Asim Malhotra.
Okay.
And I saw him on a podcast and I just went, he's the guy I've been looking for all these years because I don't want it. It's not my area. It's so painstaking for me to try to find all that literature, right?
Yeah.
So he explains that the average doctor, when they tell you you need a statin because your cholesterol's whatever, I won't say units because they're different in different
Correct.
countries. Um, the doctor has relinquished his or her power to the protocols, and the protocol writers have relinquished their power to the people paying for the protocol. Usually, some kind of big, conglomerate interest that has some say that makes statins, just for example. So it's like it's multi-layered, and the patient is like, oh, like it's like a heavy load.
You are so on point, and I'm glad we're doing this. And again, I'm surfacing to our listeners that we're both come from medicine, and this is important because we are
Right.
giving you an inside scoop from inside. It is very different than just, again, not to invalidate anyone, but very different than just someone who doesn't have this to make the comments. I hope that our audience knows that we are steeped in science and we love science and we're coming from a place of science and we're questioning this. So you go to med school, NP school, PA school,
Yeah.
and you learn these protocols. Now these protocols, we call them the gold standard,
Right.
right? We have names that sound religious. There is an indoctrination. I mean,
We even call it the dogma in psychiatry. DSM is the Bible.
the
We call it the
Bible.
Bible in psychiatry.
Yes,
I'm a
evidence-based
psychiatrist.
medicine is the Bible. It's the gold
Yes.
standard. I mean, the language, and you know that when you're in residency or you're in school, and if you're like, hey, I heard that, echinacea, and everyone's like, shh, like questioning is not appreciated.
True.
Memorization, application is what's appreciated and rewarded. So by the time you come out, right, it's teach one. What do they say? See one, do one, teach one. It's just like
Yeah.
this constant. And again, it's great. I'm happy that you're practicing appendectomies over and over again. It's an amazing skill set. But we need to understand that it's really about repetition, identifying patterns, applying these protocols, rinse, repeat. And by the time you come out of school, it's all you know. It's all you know. Now, these studies, and some of them are, really important and life-saving, but to your point, they're very expensive.
Mm-hmm.
And so the only way they get funded is if there is a medical procedure or medication at the end funding it. That's the only way. So just to give an example, if I tell the pediatric patient in my practice with eczema, go 30 days without dairy, and they come back eczema free, who's funding that study? Nobody, right? Not the milk company. There's no medication involved. So you have to start understanding that while it's important, every single study that is in an evidence-based protocol is going to be funded by pharma or a medical procedure company. It has to be. It's too expensive to run hundreds of double-blind placebo studies. It has to be. The other part is they're always going to treat one variable. If I take this pill,
Right.
what is the efficacy? Not if I sleep and I go to the bathroom every day and I, walk in the sun every day. Like if you have too many variables, it does not compute. So these studies are very, very limited. They're great if you want to study one medication, but they're very limited. Another thing our audience might not know is, at least in medical protocols, the first line of everything is like, I try lifestyle modification. It's one sentence. And then try these 10 meds. So they know that lifestyle modification works, but there's no protocol. It's a sentence. It's a meaningless sentence, like they just have to put it in. And then try the statins. Cholesterol and statins is a classic one of treating the numbers, of not treating the context, of not understanding how important cholesterol is, of ignoring the fact that the side effects are intense, memory loss and
muscle pain and
muscle
fatigue.
pain,
Yeah.
and the fact that you need this cholesterol to prevent dementia, like there's just is classic. It is a classic follow the number game, and then it doesn't matter anymore if it's triglycerides, it's still a statin. If it's LDL, it's still a statin. Like the nuances of the panel doesn't matter, the nuances of the CRP doesn't matter, the inflammation doesn't matter, and it makes no sense. It increases the risk of diabetes, which is crazy. That's a classic example. So yes, you're right that the medical community has relinquished its power, but they drank the Kool-Aid so much that they don't realize that.
Right.
And they've come to believe that everything must follow their particular set of rigorous tools, and anything else outside of that is not valid. But what I'm doubling down is that the patients drank their Kool-Aid too. Well,
Right.
you're going to listen to this guy? Why isn't this covered by insurance? Where is this
Right.
test from? You're going to just, take this essential oil. So we question it also. I did it too. Like, who's this quack telling me not to, eat something and it's going to affect so we ourselves have to question our own medical assumptions. Where did we get this from? We got it from their indoctrination. We got it from day one and from the minute our parents brought us into the office, especially a generation ago, letting us know that they have all the answers. So we have to let that go as well.
So what do you advise people? They come in, you sense that this may be someone for whom taking more power to themselves and questioning their medical assumptions would be helpful. But if you just kind of say that, like, I'm a pretty head-on person, so I can tell you that often doesn't work. Because they'll just be like, no, I've everybody knows that eating saturated fat is bad for you. So they've just turned off at that point, right?
Right.
So do you have any strategies for kind of easing them in or opening their mind, making them curious? Well, what if
The doctors?
No, the patients. Yeah, because they come in defensive. And so what's happened in the complex chronic disease community is it's become very polarized. In a little bit different way. So the poles are the people who are trusting that research will bring biomedical, i.e. drug cures for the field. And they're advocating, they've done amazing things in terms of fundraising and just public awareness. Like they've put some of these diseases on the map that without patient advocates, nobody would have even heard of, right? So they've done incredibly good work. Many of them, though, are dismissive of anything that's not kind of pure biomedical, i.e. fancy new drug. And then there's people who have gotten better, who have done other things. Like they've changed their diet and lifestyle. They've worked on neuroplasticity. They've managed their stress. And the biomedical side is very dismissive of that. You meditate, you're trying to tell me that my severe bedbound, fatigue that's keeping me in bed is going to go away with meditation. And it's very conflicted.
So I'm not ever in the world of convincing anybody of anything.
Right.
Do you? If you want to stay on that road, if you want to continue drinking the Kool-Aid, that's amazing. This is also why I tell my patients, don't try to convince your doctor to do things differently.
Right.
We are never in a place to convince others to do anything. This is about talking to yourself, right? That's the only thing we have power over is what's happening in our head. So I am speaking to the well-versed woman who loves science and data, who has a lot of aches and pains and question marks and I don't feel good-itis, who is not getting answers at her doctor's office, but is very trusting of the doctors. Like this is not the conspiracy theorists. They're trusting. They want to come back for more. They want more answers. They're starting to understand it's not enough, but they don't know what to do. Their feet are firmly planted in this, but their heart is starting to say that there's something else that's going on. They don't know how to do it without going over to the crazy side, right? I don't want to be, with these crazies. I'm a well-versed woman. I like data and science.
I have a degree often. I'm a teacher.
I have a degree. I'm a teacher.
I'm a nurse.
I'm a lawyer. I'm a nurse. Yeah. And so these women are very hard to, they're having an inner conflict, but at the same time, their body doesn't feel right.
Mm-hmm.
And so I am talking to you, if you're listening, and I want to let you know that you don't have to let go of the science, and you don't have to let go of your doctors. You just have to use them as they were intended. And they are intended to find disease. And if you have disease, you're certainly welcome to use their tools. You may and sometimes not want to. But if you're in the state of what I call pre-disease, right, which we can go into in a moment, just pre-disease, I don't feel good. It is for many people. I'm not talking, and yours is a very specific category of people who have already been diagnosed with this constant chronic pain. But a lot of people are in the state of pre-disease, right? They don't feel well. They're constantly inflamed. They're probably hormonally imbalanced if they're in our age group. But nothing shows up. So they're in the state of pre-disease for a lot of them. So what I'm saying to you, dear listener, is stay with your doctor. But just place them in the right thing. Just place them in the right. They are one department, one division in this big landscape of healthcare. And I want to allow you, validate and reintroduce you to yourself, to the skills that you use everywhere, and how you hire and how you fire and how you interview people and how you manage your kids when they eat this. They're up all night. You are constantly using reasoning skills and testing variables all day long. You like this supermarket and you don't like that one, and you like this coffee and you don't like that. You're constantly doing it, but for some reason, when it comes to health, you consistently ask this one division, this one department for questions. So I just want to empower you to start tapping into the skills. You got this far in life because you're so good at reasoning. Yep. Use it here. Use it here. Can it be that this one person, this one type of schooling has the answers for everything? Does that make sense? No, they have the schooling for one thing. Does it, so slowly. And if the shift is small, that's okay. The shift could be small. The shift could be like, I've noticed that when I don't eat gluten, my belly doesn't hurt. But my GI told me that I'm not celiac and told me that it can't be. But every time I eat gluten, I don't feel well. So a small shift would look like, I believe my GI says I don't have celiac, but I think I'm sensitive nonetheless. And I can validate that because every time I eat pizza, my stomach hurts. That's an amazing shift. Yep. That's an amazing shift. You're distancing we're not saying he's wrong. GI is not wrong, but he's not fully right. He doesn't have the tools because there is no measurement of non-celiac gluten sensitivity. There's no test for it. So you're going to have to start believing that, I'm not lactose intolerant. I went to the allergist, but every time I have it, my eczema flares up. I'm not allergic to it. I've tested for it. But you know what? The evidence is telling me otherwise. And these are the small shifts. And then we start believing in ourselves. And then we start slowly trying new interventions that maybe are not validated from this world. And that would be a win because it takes time. Yes. But I think that would be a win. But not only is it a win that you're slowly learning to validate yourself, but your next experience and the next medical experience won't be as disempowering. When you start understanding, great, I passed all of your tests. Now I'm going to do mine.
Yeah, I love that because it takes the conflict out of it, the tension.
Yes.
It's like, all of this is true, but it's incomplete.
It's incomplete.
Yes. And then I can go elsewhere also without feeling disloyal.
Yes.
So I've just been reading a paper saying, people don't tell their doctor when they discontinue the medication because they're loyal to their doctor. They like their doctor. Their doctor told them this is going to be the answer, right?
That's so true.
It just says, okay, that's part of the story, but there may be some other parts.
Yeah, there may be some other. Exactly. And if we can remove that conflict, because that conflict is, I'm going to come and I'm going to bring my binder and I'm going to show them.
Right.
They're not listening.
Right.
In fact, the bigger the binder, the more the eye roll.
Yeah.
They are not here for it. They don't have the skill set. They don't have the listening. They weren't trained for that. They have no idea what to do with it. So yeah, removing conflict, right? And that's already improving your health. Because the angst about, oh, I have to go see the
Oh,
doctor.
it's exhausting.
It's
I'm like,
exhausting.
oh, I'm feeling
Yes.
into it right now, and I'm like, oh,
Yes.
I got to
Yes.
go rest.
Yeah. So you go to them and you use them. You get the endoscopy, get the colonoscopy, get the test that you want to get. Amazing. You found nothing. That's great. I'm glad I don't have an ulcer. I'm glad you didn't find cancer. That's such great news. My stomach still hurts.
Right.
And now you're going to do food diaries and food sensitivity testing. And you're going to start creating your own tools of validation, which are just as valid, just differently designed. Just
It's different evidence. Like we have this big thing in medicine, evidence-based medicine, which is usually interpreted to mean you need a double-blind, placebo-controlled, randomized trial, the ones you talked about that cost like $1 billion.
Right.
And so they only happen for very specific, potentially lucrative treatments,
Correct.
which is great. I mean, good to
Amazing.
know if that treatment really works or not. But so it's like a mentor of mine in my community used to say, um, absence of evidence is not evidence of absence.
Oh, so beautiful.
Yeah.
That is so beautiful. It's so well said. I
Yeah.
love
She
that.
would say that to me every time I'd like get my head in a knot.
It's so true. And if they don't have the evidence also, it makes no sense to keep going back for more. You wouldn't hire more carpenters to come fix your toilet.
Right.
People come to me sometimes like, I switched my primary. Even they're like, I saw you on TikTok, I switched my primary, I'm coming to you. And I'm like, listen, I still practice primary care here. We're going to have to stay according to the guidelines because I
Mm-hmm.
don't do functional medicine there. I could just say this for you. Your primary did everything right.
Mm-hmm.
Everything right. Don't get mad. You're welcome to stay here, but you could also stay to the primary that's close to your home because he or she did everything right. What you're asking for is out of the scope of their knowledge.
Right.
And
I love it.
I also can't do it here. You need to find someone who does this. And that sometimes is therapeutic enough for them because then they're not mad so much as that. They're like, really? I'm like, yeah, I looked at all the tests. He did everything right. Amazing job. Left no stone unturned. You just can't keep going from one primary to the other. So unless you're going for like a personality change or a geographic change or a wait time change, we
Yeah.
all have the same tools. So that is often therapeutic. And I would say, if there's a clinician listening, I would say this. Sometimes clinicians are, and they're like, I get it, there's another world, but I wasn't trained for it. And so I would say to you, and this is what I often do for my patients, this is all you need to say to your patient. I believe you. Pause. I believe you. I just don't have the tools to help you. But over the years, I've acquired some great functional, holistic people that I've worked with that are wonderful and I've seen amazing things for. I've added them to my referral list next to my nephrologist, my cardiologist, my neurologist. Here, I really think do you know what that feels like to first hear, I believe you? And then for your doctor to maybe have vetted a few good clinicians in their neighborhood. So clinicians, you don't have to be the ones to do it. But just like you're not the ones to, necessarily treat the seizure or do the cath, you're referring, add the holistic providers, the functional medicine providers to your referral list and allow, like a warm handoff, let your patients
Mm-hmm.
know that you'll work with them or whatever. That is amazing, an amazing clinical encounter that any clinician can do.
I love that. I love that because if a clinician is listening, they feel an immediate burden. Like, oh my gosh, are you telling me I have to do functional medicine training and integrative training and blah? Like
Too much.
they can't do it, right? They're busy. They're fully, like, their time is fully taken up. And so by just saying, no, you don't have to learn all that. Just get to know a few people in your community and refer to them. I can feel some sighs of relief.
Yeah. I mean, when I used to do functional medicine, I had a lot of providers who would refer to me, cardiologists referred to me,
Yeah.
rheumatologists who would refer to me because they saw in the community that we were getting great results and, they trusted that I was still going to prescribe if they needed to prescribe or,
Yeah.
do. And they vetted me in their own way and they were, they gave me all their problem children, which I
Yeah.
loved. So
Yeah.
for anyone listening, I put those in quotes. I love the problem patients. They're my favorite patients. So yeah, so just add us to the referral list. You don't have to do this.
I am just feeling elated and lighter,
Oh my God.
Efrat, because you've explained what medical gaslighting is. You've shared with people listening who might be patients how they can utilize the probably very adequate, if not amazing, resources they already have and add to it. And they don't have to make a choice. And you've even given some guidance to practitioners how they can talk to their patients in a way that's not gaslighting. So validate, I believe you, and then try to put them, send them in a direction of someone who might be able to help.
Yes. That's
I
all we
love it.
do. Oh, thank you so much. Made my day.
So just before we wrap up, can you share with people what you do? Like, you've kind of mentioned a few things. Do you see patients? Do you not? You've got this big clinic, but you don't do functional medicine. Just kind of
Yes. So,
clarify how if people want to work with you, if they like what they heard, what should they do?
so I don't take on patients anymore for functional medicine. If people like
Okay.
to work with me, I speak on stages. If you have a conference, for a
Yep.
wellness center, you want me to come speak to your, about medical gaslighting at your next women's event, that is what I love to do the most. Other than that, come listen to my podcast. My podcast, like Dr. Stein's podcast, I try to bring, this is how Dr. Stein and I met because I'm absolutely obsessed with you. And you're going to be on my podcast more times. I try to identify the great thinkers of our time who are well versed and have come to the other side so that our well-versed audience can listen to them. So come to the podcast, invite me to
Yeah.
speak, and that's it.
So your podcast, which I've listened to several episodes, it's fantastic.
Thank you.
And you either do it yourself or you have guests, but you're kind of sharing what are some of those alternatives.
Yes. So it's
Those,
called the Medical Disruptor, and then I run the gamut. We have some people who do hormones. We have a pediatrician that really specializes in autism and its connection to mold. And so it just gives you direction to the people all over the country who are doing amazing things and are really willing to think outside the box.
that's fabulous. And if people want to just connect with you on social media, what's the best way to do that?
So it's just my name, Efrat LaMandre, everywhere, Dr. Efrat LaMandre everywhere, and the podcast is The Medical Disruptor.
Okay. Any last words of wisdom you want to leave people with?
Yes, don't give up. There's so much hope. And don't get angry at the people who don't deserve your energy. Find someone who believes you.
I love it. Thank you so much.
Of course. Thank you for having me.
Thanks for joining me on the Dr. Eleanor Stein Podcast. I hope you are taking away new strategies and ideas to improve your health and a renewed sense of hope. Join me, Dr. Eleanor Stein, for our next episode. Can't wait? Check out my website for a wealth of free resources.